Hey, my name is Dr. Sean Price, clinical coordinator here at The Fix in Fort Walton Beach. We're doing a series on thyroid metabolism, and if this looks like absolute chaos to you, please go and watch the previous 8 videos so that it makes more sense. Again, it is very important that you watch these videos in the order that they're being put up so that this information all makes sense to you. Okay, so on this video we're going to talk about blood sugar. Blood sugar is intimately related to the adrenal glands, and what happens, and we already talked about it a little bit, but what happens is when this is a blood sugar range, so you have normal blood sugar. When you're hungry or your blood sugar is low, you eat, your blood sugar goes up, and then it comes back down, you get hungry, and so on and so forth. So that's a normal blood sugar process. If you have adrenal fatigue or anything along those lines, or if you are a person who has typically eaten a high glucose diet in your life, then there's something that's going to happen. So you have your cell, and on that cell you have insulin receptor sites. So when you eat a meal and you eat too much glucose or too much food that converts into glucose, now this doesn't mean just eating straight sugar, it doesn't mean eating candy, it doesn't mean eating soda, it means eating oatmeal, it means eating rice, it means eating bread, even whole grain breads. Any food that converts in the body to glucose will have this high glycemic effect. Okay, and the standard American diet is full of high glycemic foods because everybody believes that low fat is the way to go. When you take low fat, you end up eating a lot of foods that are high in glucose. So when the sugar goes up like this, you get a bunch of glucose in the blood. This glucose has to get into the cell, and the way the glucose gets in the cell is the pancreas releases insulin. So insulin comes in, binds to the receptor site, and then opens up glucose, the insulin receptor, and the glucose then goes into the cell. And that's how the cells get their fuel. So this is how the glucose gets into the cell. Now this is a normal pathway, and this is how energy and fuel is created in the body. Now if there's too much glucose, then a lot of glucose ends up getting into the cell. And when this happens, through osmosis, water actually follows blood sugar and glucose. So if the glucose goes in the cell and water follows it, that cell can actually start to expand, and it can get damaged. If it expands too much, it can actually explode or lyse. So the body, in its infinite wisdom, the hypothalamus picks up on this situation. So what it does is it causes these cells to downregulate their receptor sites. So now, as this process goes on, then you end up having, when you eat this high glucose, the level of blood sugar will go up because now it can't get into the cell. So your blood sugar continually goes up. And as this process happens, your HbA1c will elevate, your triglycerides will elevate, your cholesterol will elevate. This is a stress on the body because as blood sugar goes up, it causes increased cortisol production, as we talked about in the previous video, which then suppresses thyroid function. Okay? Now here's what happens. When this happens, there's no glucose that can get in the cell, or at least a decreased amount of glucose can get in the cell. So outside of the cell, you have increased blood sugar, but inside the cell, you have decreased blood sugar. So you're now going to have symptoms of hyperglycemia, which can be pre-diabetic or diabetic, but at the same time, inside the cell, you have low blood sugar, so now you have symptoms of hypoglycemia. This is called dysglycemia. And when this is going on, this is a constant stressor on the adrenal glands. It's constantly suppressing and wearing out the thyroid gland. This is a deal breaker. If you have this going on, your body's going to become chronically inflamed. Cholesterol levels are going to go up to protect the arterial lining and to try to provide enough cortisol to support this whole process. Your blood-brain barrier will become hyperpermeable, so now the inflammation gets into the brain and starts affecting brain function, which then affects your overall metabolism. And this becomes just a major issue in the body. Okay, so blood sugar is a major contributor to adrenal fatigue and to thyroid issues. Adrenal fatigue is a contributor to estrogen dominance, which we talked about in the last video, which can block thyroid metabolism. Okay, so this is a very, very convoluted and complex metabolic pathway for the thyroid gland, and blood sugar is a major contributor to this. So if you have blood sugar based issues, if you're diabetic, or even if you're not diabetic, you suffer from hypoglycemia, or if you're pre-diabetic or you have metabolic syndrome, or any of these blood sugar related issues, they're going to wreak major havoc on your body. And you've got to get in here and resolve these things. And the testing that we do helps us find this. If you already know you're diabetic, you need to get in and see us. If you already know you're pre-diabetic or you have metabolic syndrome, you need to come in and see us. If you question it, you need to come in and see us so we can figure out what's going on with you. So blood sugar is one of the critical factors to resolve. All right. If you have any questions about this, please feel free to post it below, and we'll see you on the next video.